Good evening. I'm psychiatrist Jay Fulver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now, in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling long distance, you may call coast to coast toll free at 866-969-2720. And we now have the opportunity for you to be able to text me with a question on the air at 260-969-2730. That's 260-969-2730. All I ask is that you give me a name to which I can refer and tell me where you're from, what town you're from, and I can answer the text immediately on the air, hopefully at that time. On a fairly regular basis, we are broadcasting live from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email question I recently received. It reads, Dear Dr. Fulver, how would I help myself to stop being a hypochondriac? I'm very anxious about my health all the time to an excessive degree. Well, we don't use the term hypochondriac anymore. We use the term illness anxiety disorder. And as the name implies, you're anxious about the potential for an illness. And here's the problem about anxiety with an illness. If you have anxiety concerning an illness, the deep parts of your brain, the more primitive parts of your brain, actually think you do have the illness. So from your brain's perspective, you're taking on the anxiety and the apprehension and the uncertainty of having the illness itself, even though you don't have the illness. So you're actually destroying your health by worrying about the potential for an illness. So it kind of goes round and round. And what we'll often do with people who have illness anxiety disorder is allow them to emphasize the gratitude they have for the health they are currently experiencing. So their good health, we try to help them remember what they have going for them. So we have them try to remember the different ways that they are establishing health. And we do remind people, yeah, there's illnesses that occur. We've got to be realistic about that. And we all have a certain expiration date where we do have mortality. We can't change that. We all have that expiration date. But at the same time, we have to remember that if we're persistently anxious about illness that hasn't occurred yet, our brain will, unfortunately, in the primitive areas, interpret that illness as already occurring and create a lot of stress unnecessarily. So you want to focus on your aspects of health and vitality that you still are experiencing. Enjoy it. Know that as the time goes on, yeah, your broad body does naturally break down. Do the best you can to try to support it. And eat healthily, exercise on a regular basis. And actually socializing is good for the mental health. So try to maintain as much activity as you can while you can, realizing that illness can come. And if it does, you deal with it at that time. Thanks for your email. Let's go to our first text. It's from Lucas. Hello, Lucas. Welcome to Matters of the Mind. Lucas, you're from Fort Wayne. You texted in and said, I frequently forget to take my sertraline, that's also known as Zoloft, for days at a time and struggle to take the medicine at the same time every day. Will this cause long-term damage? The good news, Lucas, is it won't cause long-term damage by forgetting to take the sertraline unless the sertraline's really helping you. Now, my question is, if you're forgetting it for days at a time, is it doing much for you? Or on the other hand, has it worked so well that you might not need it anymore? That's always a good thing. But many people will use sertraline or Zoloft for depression. They'll use it for anxiety conditions. And as they use it over the course of time, they find that they don't need it so much, which is great. If that's the case, talk to your clinician about the possibility of tapering you off of it entirely so you don't have to worry about taking it. If you're missing it for days at a time, I question if it's even worthwhile for you to take. So with that being said, if you miss a day here and there of sertraline, you'll get zings and zaps. Zings and zaps in the hands and the feet. You'll feel lightheaded and dizzy. Some people get those zaps in their scalps. It's an unfortunate type of phenomenon where if you miss a dosage of the medications in that class where they affect serotonin and norepinephrine, you'll have some discontinuation phenomena. So It's uncomfortable to do that, so I talk to your clinician about the possibility of you tapering off sertraline entirely. If you need it, you need it. Okay, if that's the case, try to take it daily. Sertraline is not so important as some other medications that take exactly the same time every day, but get into a routine of taking it where it's easy for you. So for some people, they'll notice that it's easier to take it in the morning. Some people say it's easier to take it at bedtime. I'll encourage people to get a pill box and just take it day by day by day, and they can see if they took it or not. But if you don't take it exactly at the same time, sertraline's not highly problematic in needing to take it at the exact same time every day. Some medications you really need to take at the same time every day. Examples would be Effexor, also known as venlafaxine, another medication being paroxetine or Paxil. These medications can give you some discontinuation phenomena if you don't take them about the same time every day. But sertraline is not one of them. Thanks for your text, Lucas. Let's go to our next text. We have another text from Caroline. Caroline, you had asked about high cortisol levels. Do high cortisol levels affect your feelings of safety? I'm challenged by the feeling that my faith has failed and I feel unsafe all the time. Well, Caroline, high cortisol levels are a result of feeling really stressed out. So when you're stressed out, cortisol starts going higher. And it's not uncommon for people to try to exercise to try to deal with cortisol levels, because cortisol levels, when they're elevated, will cause you to have higher glucoses and cause you to have difficulty with metabolic disturbances such as a higher waistline. So high cortisol is not healthy for you. Exercising is one way to try to deal with that, because chronic unmitigated stress can cause you to have high cortisol. Well, you had asked about possibly losing your faith and wondering about other factors associated with it. I think what you're describing is the chronic unmitigated stress that people will experience, where you haven't encountered these particular stresses in your life, and in doing so, you haven't been able to navigate how to get through them, and that will increase your cortisol levels. So people ask me all the time, how do I get rid of stress? Well, you don't want to get rid of stress in general, because if you got rid of all stress, your days would be exactly the same day by day by day. And you might think, well, that would sound great. Not really. You'd get really bored if your days were the same every day. We need to be challenged. We need to be sharpened, so to speak, as a means of getting us more motivated to do more things and be able to enjoy life. So part of the human experience is to be able to adapt to challenges, and challenges are what stress is all about. When you have chronic unmitigated stress, it's where the stress is overwhelming for you. You haven't experienced those kind of stresses before. You're not sleeping, you can't think through them, you can't process information adequately. And as I always mention to people, when you're under that kind of stress, what's happening, your little amygdala down here in the temporal lobe gets all fired up. You got one on the left side, one on the right side. And when the amygdala gets fired up, you can't sleep very well, because anxiety is keeping you awake at night. If you don't sleep very well, the front part of your brain doesn't get adequately recharged. If the front part of the brain doesn't get adequately recharged, you can't think through life's problems adequately. So those day-to-day changes that we all should experience, you're going to find difficult in which to navigate and adapt. And that's the whole concept of psychotherapy or counseling. With psychotherapy or counseling, it's like a GPS for the brain. A counselor or a psychotherapist is trying to help you navigate through life's difficulties, similar to a GPS in your car, helping you navigate to a location in which you're not familiar. So it helps you turn right or left. The therapist looks at your life circumstances, looks at your strengths, looks at your weaknesses, your resources, and the therapist will let you navigate the direction where you need to go. So I think that's the key for you right now, to try to get some control over the stresses you're experiencing at this point. And that indirectly can decrease the cortisol excesses that people sometimes can experience. Thanks for your text. Let's go to our next caller. Hello, Lydia. Welcome to Matters of the Mind. Lydia, you want to know about weight loss drugs like Ozempic. Can they affect your behavior? Ozempic is it's called semaglutide. It's in a class of medication called glucagon-like peptide. Glucagon-like peptide, GLP type 1. Glucagon-like peptide type 1 agonist, so they call them GLP-1 agonists or GLP-1s. So that class of medication has been extensively studied. Many people are talking about them nowadays because they are dramatically decreasing the appetite, and they can actually physically help you with weight loss by decreasing fat. My biggest concern about Ozempic or any GLP-1 agonist is that they can decrease your muscle mass. And as a psychiatrist, I want to stay in my lane here because I don't want to get into the area of other specialists, but as a psychiatrist, what I'll hear about people sometimes on the GLP-1 agonists, such as Ozempic, they'll say that they're losing muscle mass and that will make them tired and give them less initiative and less strength. So when I hear about that, I emphasize to people on the GLP-1 agonists to do resistance training. As we get older, we tend to naturally lose muscle mass. After about 35 years of age, you gradually lose muscle mass year by year by year. And it's very important as an older adult to do resistance training to build up that muscle mass. The GLP-1 agonists actually shrink down the muscle mass as well as the fat. Now, on the good perspective, a GLP-1 agonist, if you're losing fat, that's going to have you lose adipose tissue. If you lose adipose tissue, you're going to have less inflammatory proteins. Fat cells will fire off inflammatory proteins. Inflammation of the body is not good. Inflammation causes a lot of illnesses, but inflammation proteins will go to the brain and cause you to have more depression. A sign of depression related to inflammation in the brain will be sadness, lack of enjoyment in things, low motivation, low energy, and poor concentration. Those are all symptoms of an inflamed brain, and that can come from fat cells. So on one hand, the behavior changes from semaglutide type products can be good in the sense that you'll have less inflammation and you might have more energy and better concentration in some ways. However, you can feel fatigued if you lose the fat and the muscle, because if you lose the muscle, you're going to be less strong. So I would strongly emphasize that depending on the issue, if you're having behavioral changes, to look at the issue at hand, see if the GLP-1 agonist is worth it to continue. The problem with those, I'm hearing it again and again, once you go off of them, the fat comes on really fast. So once you're on them, keep in mind it's probably going to be a long-term relationship. So you're not going to be engaged to the GLP-1 agonist. You're probably going to be married to it. And that marriage is a long-lasting covenant from what I'm hearing from people. There's going to be a lot of studies on those medications over the next few years. I'm looking forward to seeing how it turns out because I'm hearing studies saying that the GLP-1 agonists will possibly decrease the likelihood of Alzheimer's dementia. So I'm really excited about hearing about potential uses of these medications in all sorts of areas, but there can be some drawbacks and you have to be conscientious about that. Thanks for your call. Let's go to our next caller. Hello, Tricia. Welcome to Matters of the Mind. Tricia, you had asked about your child getting, your child is bullying other kids at school. Is there an underlying reason why a child might be bullying others, and what should you do? If your child is bullying others, it comes back to one factor and one factor only from what I hear. I'm not a child psychiatrist, but you've probably heard it before. If a child is a bully, that bully is likely has a very low self-esteem. And children who will bully others often lack the empathy toward others, but they also have a very low self-esteem themselves. And bullies will often find power in their intimidating other people, and that's not a good thing, obviously. And sometimes they'll be gravitating toward gangs because then gang behavior or really tight niches and cliques can give them a further sense of empowerment, but it'll give them a sense of belonging. So if your child is bullying other children, take a look at your child's self-esteem and try to address that in various other ways and give your child self-esteem in various ways, but also really emphasize to your child the importance of empathy and helping your child understand about the feelings of others and how he or she may be coming across to other people. Thanks for your call. If you have a text question you'd like to text me on the air, I'll try to answer your text on the air, and you can text me at 260-969-2730. And again, remember to include your name and where you're from. And I'll go to the next text with James. James, you have a question about exercise and depression. James from Fort Wayne. James, you're wondering, can exercise cure depression, or does the treatment of depression require medication? Exercise can have a significant impact in treating depression, James. And I've heard the same phenomenon with a ketogenic diet, a low carbohydrate diet. These exercise, low carbohydrate diet, they can significantly help depression for a lot of people. How do they help? Well, basically exercise is a means of treatment, you could certainly convey, but where you'll increase a couple neurotransmitters at the same time. One being glutamate, one being GABA. Glutamate is the accelerator in the brain. Glutamate consists of about 80% of all neurotransmission in this outside thinking part of the brain, whereas GABA is the brakes on the brain. So glutamate's the accelerator, GABA is the brakes. Glutamate's sitting, pushing on the right pedal, GABA's pushing on the left pedal, and they're working in tandem. Exercise enhances both glutamate and GABA. That sounds weird, but the effect of it will be you feel energized from the glutamate, but you also feel calmer from the GABA. And many, many, many people will say after the exercise, whether it's just 20 minutes or 40 minutes, they'll say they feel more energetic, but yet they feel calm at the same time. And rarely do you ever hear about anybody say they feel worse after exercising. If they do, they've probably overdone it. They're dehydrated, they've got electrolyte disturbance, something's going on and feeling worse after exercise. But yeah, exercise will stimulate these natural brain fertilizers in the brain. They're called growth factors, brain-derived neurotrophic factor, mammalian target of rapamycin. These are natural fertilizers in the brain. Exercise, to some degree, can stimulate those particular natural exercises, natural fertilizers. Medication can do the same. Medication will often do it very quickly. For instance, there's a medication that came out for anesthesia 25 years ago called ketamine. It's been used what we call off-label or unofficially for the past 25 years in the IV form. Spravato came out as S-ketamine. It's a left-sided piece of ketamine. It came out in 2019. And now we have Auvelity, which came out about 3 years ago. It also affects glutamate. So you've got ketamine, S-ketamine, and Auvelity. They're indirectly affecting glutamate. And in doing so, what they're doing is indirectly enhancing the brain fertilizers and allowing the little neurons to become more fluffy. Now, if you look at the neurons themselves, neurons look like a plant. You've got the roots on the plant, you've got branches on the plant. Individual neurons have roughly 50 to 60,000 branches per neuron. So imagine a plant having 50 or 60,000 branches all over it. That's how a neuron should look. If you have ongoing stress, depression, you're having difficulty coping through life, your little neurons get all shriveled up just like a plant would get shriveled up if that plant was under-fertilized or underwatered. So what you try to do is fire up the branching of the plant, the roots and the branches themselves, and thereby the neuron can work more effectively. Ongoing exercise can make the branching more likely, but in terms of somebody with a clinical depression where it's significant to the point where they're having trouble going to work, going to school, trying to do the things they'd like to do, if they're having ongoing depression like that, yeah, medication can work faster. And what we try to do is once you're feeling better from medication, get out there, exercise, socialize, do things that are enjoyable, do the things that will further enhance that fertilization, because it's one thing to get feeling better, it's another to start doing things that will actually be meaningful to allow you to stay well. So we want you to get well, but we want you to stay well, and the way you stay well is by doing things that are meaningful on a day-to-day basis. Thanks for your text. Let's go to our next text. Our next text is from Carolyn from Angola. Hello, Carolyn. You are asking, what is borderline personality disorder and how is it treated? Well, borderline personality disorder, from my perspective, is a type of bipolar disorder. Bipolar disorder is where you'll have distinctive elevations of the mood, decreased need for sleep, racing thoughts, distractibility, impulsivity, and in the case of borderline personality disorder, you can have ongoing distrust, anxiety, and difficulty with moodiness that's like a roller coaster. So borderline personality disorder is a type of bipolar disorder where you're very reactive to stress, you're very reactive to your environment and people around you. So when stuff is happening around you with borderline personality disorder, you're very quick to react, you'll be impulsive, you'll overreact, you'll be devastated with this perception of abandonment, you'll have difficulty when somebody says something the wrong way to you. You'll have rage, anger. Sometimes people with borderline personality disorder will have transient psychosis where they're briefly out of touch with reality. This all happens very quickly for a matter of minutes, hours, but rarely more than a day. And that's borderline personality disorder. It originates often from childhood experiences. If you've had a mother, father, brother, sister in the family who was emotionally distant to you, especially a parent, or you were abandoned as a child, if you as a child had emotional, sexual, or physical abuse, maybe had post-traumatic stress disorder, you're more likely to have borderline personality disorder later on. So it's a condition where, yeah, on one hand, there's the drama that everybody experiences to some degree in adolescence, but with borderline personality disorder, that exaggerated reaction to the environment or people around you will be noted in your 20s and even 30s for that matter. But yeah, in my mind, borderline personality disorder is more of a condition that's related to bipolar disorder, that's reactive to people and situations. You treat it with dialectic behavioral therapy, various types of counseling can help with borderline personality disorder. We do use mood stabilizers to help people to put up with stuff better. So we try to help people with what we call stress resilience. So we give them mood stabilizers to help them put up with the stresses that they're seeing. Thanks for your text. Let's go to our next text. Hello, Tom. Welcome to Matters of the Mind. Tom, you're from Columbia City. You were wondering about retirement. You've just retired and you were very excited about it. That's fantastic, Tom. However, I seem to be struggling with not having to go to work and finding something to do with my day. What can I do to help with this adjustment? Tom, you need a schedule. Here's what happens. People get really excited about retirement. The first week goes great. Well, it's called a vacation, Tom. I mean, basically you're not working. That's a vacation. Second week is like a prolonged vacation. Now you're in the third week, the fourth week, the fifth week. Now what do you do? Well, when you were working, you had places to go, people to see day by day. You had obligations. You might have worked Monday through Friday. You had the same routine, and you're thinking, I can't wait till I retire. Well, now you have the opportunity to do things that you want to do. Now, within your financial constraints, do what you are able to do at this point, but you need to have a schedule. Don't sleep in day by day. Be careful about that. Many retirees will sleep in till 10 o'clock, 11 o'clock in the morning, and they just don't really have a reason to get up. Get up first thing in the morning. One of the best things you can do the first thing in the morning is to exercise, do a Bible study, go out and meet with other people, go to people who don't have joint replacements are playing a lot of pickleball now. I hear about that a lot. But you have to have a schedule, have it on your calendar of things to do day by day. Now, you might not need to have the 8-hour obligations anymore. My goodness, Tom, you get to take a nap when you're retired. So you can take a nap in the middle of the day for maybe 30 minutes and get some rest. That's okay. But you might not need 8 hours of obligations day by day, but maybe have 4 hours of obligations, because for all of us, it's not the doing of things in the future that are most important. It's the preparation and the anticipation and the excitement of doing things in the future. So if you see something on the calendar for Thursday this week and you're getting excited about it, great. That actually helps your brain work better, but you're at a high risk for depression if you don't keep yourself busy and do things. And the wonderful thing about retirement, you're financially more stable to be able to do things you really want to do. But I'd first encourage you to get up at the same time every day the best you can. And if you want to sleep until 8 or 8:30, that's okay, but don't sleep in until late morning and don't stay up all night. I mean, it sounds like fun for a while, but it destroys your circadian rhythms. Try to get to bed at a decent time at night. Get up about the same time every morning, but have things to do, and getting a routine first thing in the morning to get the day started right can be very helpful. I've heard some people say that merely making their bed gets their day started properly, and then having a routine day by day can really help, and that's especially during retirement. So, Tom, congratulations on your retirement, but time for you to get busy with doing things you enjoy, find pleasure in different things, but have a specific calendar in mind to keep things on track. Tom, thanks for your text. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, my doctor prescribed phentermine for weight loss. It's giving me a lot of energy and helps with my mood, but another doctor said I couldn't take it with an antidepressant. How does it work? Well, phentermine is a medication, the trade name is Adipex, used to be called Fastin. And it's a medication that will push out from a neuron. If you think about the neuron as being like a shotgun, it's firing out norepinephrine. Now, it will fire out to 10 times lesser degree dopamine and 100 times lesser degree serotonin. So primarily it's firing out norepinephrine, and it's firing out a little bit of dopamine and then firing out even less serotonin. So here's the deal. You could probably take a purely serotonin medication if you're really careful, because the serotonin medications keep the serotonin floating around in the brain for longer periods of time. In the case of phentermine, you are firing out more serotonin. So If you give a serotonin reuptake blocker, it's decreasing the vacuuming of serotonin back into the firing neuron, thereby giving you the possibility of serotonin toxicity, but it's very slight. The biggest concern I would have with a medication for depression with phentermine would be a medication that's increasing norepinephrine. A medication such as the old tricyclic antidepressant medications or the newer ones such as Fitsima, Savella, Pristiq, Effexor. These are all medications that are increasing norepinephrine, and in doing so by blocking the reuptake of serotonin or blocking the vacuuming of norepinephrine, blocking the vacuuming of norepinephrine. If you're firing out more norepinephrine and blocking the vacuum of it, you can have high blood pressure and have some detrimental effects from that. So there are certain antidepressants you could take, but certain ones you don't want to take. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the email at mattersofthemind, all one word, at wfwa.org. I'm psychiatrist Jay Falver, and you've been watching Matters of the Mind, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.